Hi, I'm Maggie Scoofus, and welcome to Channel 4 News. Today, we have a special look back on the tragedy that struck our town just a few months ago, the zombie apocalypse.
Welcome Jenny Gennaro, a survivor of this horrible disease. Hi Jenny, how are you?
Well, considering 2 weeks ago I was a zombie, I'm doing alright.
So, tell me about your experience with the disease.
Well, I caught the virus from a friend of mine who's no longer with us. She caught the virus from a friend of hers that was bitten by her dog. At first, I didn't know I had the virus. After about 5 days, I got really dizzy. On the 6th day, my skin turned white and was ice cold. I still went to school because I thought it was just the flu. The day after that is when I realized something was actually wrong. My legs started falling out from under me and I couldn't move my hands. I got scared that I might have actually gotten this virus and went to the hospital to see if I had it. My worst nightmare had come true. Luckily, they had started working on a cure and I was administered with the cure and was thankfully cured before I had turned completely.
So you said it was a dog that was the initial carrier?
Yes, it was a friend's dog who was at a dog park. The dog bit her and she got the virus. She spread the virus to my best friend, and when I took a drink at lunch, I got the virus through the transfer of saliva. Okay, we're done.
That's it.
This is a picture of the virus that will later be explained by Dr. Flynn.
Yeah.
So tell us a bit more about this virus that shook the Midwest.
Well, thanks for having me on the show. And it is well known that only a few weeks ago, the zombie virus struck a small town in New Berlin, called New Berlin in southeastern Wisconsin. It was a terrible tragedy, to say the least. The virus had propagated in the saliva of canines and was then able to jump species. The transmission to unsuspecting dog owners was where the infection first began to take root. Dizziness and flu-like symptoms had occurred in the first week, so people who contracted the virus had no idea of the severity and just thought it was a common cold.
And after the first week, infected people began to show the severe symptoms that gave the disease its name?
Yes, during the second week, the central nervous system is affected. The somatic result is uncontrolled spasms, babbling, or confusion. Week 3 is when the characteristic hunger emerges. This is due to the corruption of neural pathways in the hypothalamus, which controls factors such as hunger or appetite. This condition was the beginning of the zombie slang, and the virus's detrimental effects are irreversible at this point during week 3.
It was quite distressing. There has been controversy surrounding the treatment of week 3 patients. Can you elaborate?
Well, during week 3, as publicly announced, the acts of cannibalism were starting to take place. They were witnessed from individuals who had contracted the zombie virus and had had it for about 3 weeks. Their reasoning was impaired, and various other detrimental elements were at play. Due to the severity of this brief yet devastating epidemic, an emergency state was introduced. The Public Health and Safety Board thoroughly reviewed what was known about the viral infection, and after it was concluded that there was irreparable damage sustained in week 3, the week 1 and 2 patients became the priority. Diagnostic tests were always performed in the spinal fluid of the victims, just so you could determine how far the virus had taken root in whichever person who was infected was being diagnosed. People who had the infection for a longer period of time had allowed for a longer gestation period for the virus, and therefore were very contagious, especially after death. Therefore, they had to be isolated, and during that time, they would usually pass. Some patients, though, were given pain medications to soothe their passing, because their death was inevitable. And it was very difficult to endure from a medical standpoint as well. But the health department was only doing what they could to contain the virus.
Please tell us a little bit more about the cure, Dr. Flynn.
Basically, the patient is injected with a vaccine, and it contains antibodies that pick up the virally infected cells so the immune system can recognize and attack them.
Could you explain the graphs that you brought with you today?
Yeah, for this graph it shows the amount of people infected over time with a cap at 500. In week 1, there were about 10 people infected, week 2, 45, and week 3, 295. As you can see, the infected went up exponentially. After we had implemented the cure at about 4.5 weeks, then the infected people dropped immensely. Sadly, there were several deaths of the patients that had contracted the infection during week 1 and 2 because they had the infection for more than 2 weeks. So this graph shows the population and the infected people, not including the deaths as infected people. So we have lower numbers as you get farther into the weeks that the virus was active.
Thank you for coming to the show, Doctor. Now let's switch to an interview with a local public health representative. So there's the virus that is causing people to attack one another. How should people maintain awareness of the community?
Well, community awareness is really up to the infected of the family or the infected. It is too difficult for neighbors or the police to constantly check up on every home to make sure there are no infected. If someone gets infected, it is up to them or their family to report it. Staying quiet about it is one way to guarantee that the infection will progress and potentially allow it to infect other individuals.
So, say some members of the community don't do their job and report their infection. How should people avoid the infection?
Stay away. The infected may seem slow and harmless, but they can suddenly lash out if you approach them. All it takes is one cut to contract the virus, and the infected can accomplish this very quickly. If you know there are infected in your area, the best thing to do is lock your door and stay inside. Don't open the door for anyone, especially if they appear to have wounds caused by an infected. This all holds true even for friends and family. An infected family member who has progressed to the later stages is no longer your family member. They don't remember who you are and will attack you anyways. Stay away from all infected, regardless of who they are.
Now, what if everything goes wrong and you contract the virus anyways? What should you do?
Immediately call the police and report it to people around you the best you can. The best thing to turn yourself is into the hospital, where staff will do their best to cure you. However, if you know you will not be receiving help from the authorities, or you can't take yourself to the hospital, have someone restrain you or attempt to restrain yourself. It may seem harsh, but it is the only way to prevent you from harming those around you. Hopefully that will be unnecessary, though.
Although the virus may be over and all the patients have been cured, we should still take precautions to save our community. In case the virus may still be in our environment, everyone should look out for symptoms of dizziness and pale skin. If you get these symptoms, seek help immediately. Make sure to stay out of contact with others. If you haven't already, go to the hospital to receive the vaccine. This vaccine will protect people from future infections of the zombie virus. Please do your part to save our city from the zombie virus. That's all the time we have today. Thank you for watching Channel 4 News. I'm Maggie Skoufis.